Hey everyone, it's Dr. Jen. Welcome to What's Up Wednesday. So glad I could be here with you today. I just stopped seeing patients and came right in my office so I can speak with you today. It's still crazy here in New York City with a lot of flu, stomach virus, strep, you name it. In pediatric offices like mine, we're inundated at this time of year. But I definitely wanted to speak to you because I thought this is a really important topic. We're going to be discussing today, or I'm going to be talking to you guys today, all about avoiding medication errors with your children, which actually may be more common than you even know. And also, importantly, how to get that medicine to go down when your child is sick. I know it's really hard to do as a mom, as a parent, especially when your child's not feeling well. They can be really obstinate and just not want to take that medication because they're not feeling well. So I'm going to give you some tips and some tricks and hope that helps you during this terrible cold and flu season to help your little kiddies feel a lot better, or even your big children as well too, as in case point for my 3 kids too. So welcome everyone, it's Dr. Jen. For those of you that don't know me, I'm a assistant clinical professor of pediatrics at the Icahn School of Medicine at Mount Sinai, and I've been in private practice for over 20 years now, taking care of kids from newborn all the way through young adulthood. And so it's so amazing to see these kids flourish and change and develop and really then take charge of their own health. But as new parents, I know how difficult it really can be. So stressful and a lot of anxiety when your child is sick, but also about keeping them healthy and happy for the years to come as well too. And that's why I made Pediatrician in Your Pocket. And it's my new parenting video series, really comprehensive, everything you need to know about caring for your baby from newborn to age 2. And it's just really a helpful guide. You can just go through the parts that you need when you want to know it. There are probably even questions that you didn't even know or wanted to ask that you didn't even know that you should be asking. So it's so chock full of lots of information: feeding, sleeping, eating, nutrition, developmental issues, parenting advice, just lots of tips also, being a pediatrician for over 25 years and also being a mom of 3. So if you want more information about Pediatrician in Your Pocket, go to my website, drjen.com, and right there you can click on the link and find out so much more and download Pediatrician in Your Pocket. But today I sort of want to jump right in. We're going to be talking about avoiding medication errors and then some tips on getting your child to take their medications. So to start with, you may not know this, but medication errors are really common, especially when it comes to children. In fact, every 8 minutes there's actually a medication error in this country. So that's quite a lot. And some of them may just be simple, giving an excess dose or forgetting to give medicine, but obviously there's overdoses as well too that could be really serious. And a common reason for ER visits is often medication errors or accidental overdoses. So let's talk about some ways to help prevent this from happening to your child. So the first important information to know before giving your child a medication is their weight. It's really important to know your child's weight. So one, obviously when you go to their pediatrician visits, you will inevitably they'll be weighed and measured. So make sure you write that down or keep it in your phone. Whenever we give a child medication, it's based upon their weight, not their age, right? Your age, children, some are really skinny, some kids are really tall, so it can really vary. So medication, particularly for children, is based on their weight. And for pediatricians, we actually do that in kilograms, but here in the United States, we mainly use pounds and ounces. If you want to convert, just to let you know, you just divide by 2.2, and that will give you the kilograms. But most medications over the counter, it says it in pounds. And actually, oftentimes it says it by age, but the more accurate is always to go by their weight, and that's what your pediatrician will ask you if you have a question on medication. So tip number 1, make sure that you use their weights when giving them a medication. Then you also want to make sure that you use the measuring device that comes with the medication. So this may be news to you, but for example, if you buy an over-the-counter medication, a fever medication, and it comes with one of those little cups and it has the measurements on it, a teaspoon or 5 mLs, 10 mLs, they actually make the measurements with that leeway, because some medicines are thicker than others, that when you take the medicine that there may be some left over in the cup, so that they actually account for that as well too. So you want to actually use the measuring device when at all possible that comes with the medication. That's the way you're going to get the most accurate dosing for your child. So that's really important. The other thing, and this is a common error, is not to use your regular old kitchen spoon to give medicine. Even if your doctor prescribes a spoonful, you want to make sure to use a measuring spoonful, or even better yet, like a medicine dropper that has a really accurate measure. Kitchen spoons, a teaspoon, can actually, they've done tests looking at them, they're more for decorative, they're not really measuring spoons, so they could actually be anywhere from 3 mLs to 7 or 8 mLs. And another math lesson here, we'll do a lot of math in pediatrics because kids come in all different shapes and sizes. 1 teaspoon is 5 mLs, and a tablespoon is 15 mLs, so it's 3 times the size. So it's important to know if you gave them a teaspoon worth or a tablespoon worth, because I know oftentimes people say to me, oh, I gave them a tablespoon. I'm like, I don't think you gave them a tablespoonful. Like, yeah, I did. I said, no, I think you gave them a teaspoon. They said, oh, yes, a teaspoon. So a teaspoon is only 5 mLs. So use a measuring teaspoon or a medicine dropper that measures out 5 mLs, which also brings me to saying in general, it's much more accurate to give your child the medicine in milliliters than in spoonfuls. So for example, like 3/4 of a teaspoon, that can be really confusing. Is it 3 mLs, 3.5, or 4 mLs? So they're getting various amounts. And again, may not matter, but some medications you really need to be really precise and accurate. So ask your pediatrician or whomever is giving you the medicine, can you please tell me what that is in milliliters? And you'll get a much accurate measure to give to your child. And I think that's super important too. So another important thing, whenever you're getting a prescription medicine, or even if it's something over the counter, and you want to make sure you know specifically what that medication is. So ask your doctor, what is the, if they give you a name, is that the generic name or the brand name? And make sure that you know both, because oftentimes now the doctors are just used to saying brand names, but when they go to get it filled, it's the generic name, and it's totally different. So then you get this medicine and you're not sure if it's correct or not, and then so you need to ask the pharmacist. But knowing ahead of time the generic name can be much, much simpler. And just on that note, it depends, but for most medications, generics are totally fine. They're getting the same amount of medicine, whether it's now become a generic, and so that's usually a cheaper form. But for the most medicines, you can, again, ask your pediatrician if it matters, depending on what your child is taking. But usually the generics are a lot cheaper, and they're totally fine. And I use generics all the time in my family. Again, it's just a cheaper method, and what usually often is a deterrent for kids is the flavor. So depending if the generic has a good flavor, it's usually fine, because the potency should be equal to that of the brand as well too. So another question to ask your pediatrician or your healthcare provider is, how many times a day is the medicine? So you want to exactly know what you're supposed to be giving your child. How many times a day is the medicine? Is it once a day, twice a day, 3 or even 4 times a day? And I'm going to give you a little hint, or a little tip actually. Medicines and pediatricians know this. It's difficult enough to give your child medicine, right? So we try as much as possible, if we have to give a medicine, that is only once or twice a day. There are a few antibiotics that may be 3 times a day, but mostly we now can give most antibiotics once or twice a day, and 3 or 4 is not needed. I had the patient this other day, just to give you a little story, who came to see me, whose child was having ear infections and was not getting better, and they were concerned, is it time now that they need tubes for their ears? So I went through the whole history, saw the child, and asked them, what medication. They brought it and they showed it to me, and here I see on the bottle it says every 8 hours. So I said, well, how many times a day are you giving it to the child? And the mom said every 8 hours. I said, well, what does that mean to you? She said, well, I give it to him before he goes to school, and then he stays at daycare, and after school is an extended day, and then he gets home, and so at dinner time I give it to him again. But I don't give it to him another 8 hours after that because he's sleeping. So I said, to clarify, so you're basically giving it to him twice a day, correct? She said, yeah, I'm giving it to him twice a day, 8 hours apart. I said, okay, but the instructions are really every 8 hours, which to me and to doctors, that's actually 3 times a day. So the reason the child's ear wasn't getting better is they weren't getting all the medication that they needed. So it's important to find out if the doctor wrote 8 hours a day, is it okay to give 3 times a day, and does it have to be exactly the same? So could it be morning when they get home from school, and then closer in the evening? Because sometimes medicine is okay to give it at an earlier interval as long as it's 3 times a day. Or the same medication, as a pediatrician, I know you could break that dose up into twice a day. So that would have been fine, but the dose would have been a larger dose for twice a day. So it's important to really understand the instructions and make sure that you're giving the appropriate amount and timing to your child when it comes to medication. So I hope that's clear. So make sure that you ask when you get the prescription, what medication, what's the generic, how many times a day do I give it to my child? And if it's seeming a lot, you can ask if there's any other alternative as well too. It's fine to speak up. Your pediatrician then may be able to help and change it to a form that may be easier, particularly if your child's in daycare or school all day as well too. So that's on how many times a day. What else? You also want to make sure that your pediatrician knows of any allergies. So even though it's in the chart, I always ask moms, because there may be changes. They may have gone to an urgent care center, and I might not have all the information. So besides looking in the chart, I always ask moms, does your child have any allergy? So that's important. There's also medicines that have cousins of each other, and these medications can interact or may be more likely, so you may want to bring that up to your patient. Sometimes it's important you have to use a medication anyway, but if they have any allergies, always speak up and let your pediatrician know about that, because as I said, things can change over the years. So I know when a child is sick and they come to see me, right, and they have fever and they don't feel well, and they're so cranky, and I see them at their well visit and they're so happy and playful, and it's just obviously not in their nature to be cranky, but they're just not feeling well. So you're giving them medicine for the fever or just pain reliever, then you may have to give an antibiotic or a different medicine, and it's often very difficult to remember, did you give it, did you not give it? You know, you have mom brain, you've been up cleaning up the vomit, or you've been up because your child is just not sleeping because they're congested, so you're just so tired. So how do you know if you gave that medicine or not? So the best way is to write it down. You have to keep a log of the medicines that you give your children. You can give it on your phone if it's easier. To me, paper and pen is still the easiest. Hang it up on the refrigerator or wherever you keep the medicine. You can even make a log ahead of time. You can either, I'd say, write down when you gave the medicine and check it off, or you can just put down Monday, Tuesday, Wednesday, what time you're supposed to give the medicine, and then when you give it, you can make a check next to it. And this is important, especially if there's more than one caregiver as well too, right? So mom or dad or babysitter. You may leave and you know, think, did I give the medicine or did I not give the medicine? This way you all have this one list that you're working off of, and it makes it so much easier, especially if there's more than one medication. So really keep an accurate log, and I think this is really important to do, and that will really decrease those errors of double dosing or not giving your child a dose when you know they could feel better if it was okay for them to get another dose of, say, fever reducer. So keep accurate records while you're taking care of your child, and it will be just that much easier for you and your baby. What else? So, another error that often happens is not giving the full dose. So let me explain that as well too. So for example, sometimes I have parents that come in and say, oh, you know, I don't really like to give pain reliever, or I don't really want to give a fever reducer, so I just gave a little and it didn't work, so then I had to give it again. So this still isn't working, and so then I had to give a different one on top of it, and then they start alternating, you know, ibuprofen and acetaminophen because they're not really working. And so then I ask them, can you tell me specifically what you gave them and the dose? And so oftentimes they say, well, I only, you know, I know her dose is a teaspoon, but I'm only giving her half. So that's the reason why it's not working. You have to, as I said, it's done by their weight, and so it's important to really give them the correct full dose. So if you don't want to give them anything, that's fine, but if you really want to help their pain, then you want to give the correct dose, and they'll actually start to perk up, feel better, drink, be happy, and even be able to you know, be more interactive and eat and drink when they're feeling better. So if you do give medicine and it's necessary, give the full dose each time. Then you may be able to spread it out more because they are getting that full dose. But if you only give half or a little bit, then it's not going to work. So I think that's important to know. Really give the correct doses each and every time. So what else? Oh yes. So we talked a little bit about if you get a prescription from your pediatrician, you want to know how many times a day, what the medication is, and for how long. How many days are they supposed to take it? So is it a 7-day course, a 5-day course? Is it a 10-day course? And it's important to know because it's not always the whole entire bottle. And it maybe even be that they need to refill the bottle depending on what the prescription is for. I often tell patients the exact days. For example, if they are sick and they need to take a medicine for 10 days, I will tell them 10 days. But I may often put more in the bottle because I know, as a mom and being a pediatrician for so long, that sometimes it gets spilled, it gets knocked over, they spit it out, and you have to give the medicine again. So I give a little leeway and sometimes am able to give more of the medicine so that they have it just in case. So it's important to know, am I supposed to finish the bottle, or is it okay to stop after the designated 7 or 10 days? So make sure that information is clear right from the start so you don't make mistakes when it comes to that. You also want to make sure that you don't share between siblings. Again, doses are based on their weight, and so it may be a different dose for your other child. And that's important because, again, what you're treating may not be the right thing, or they may need a different dose. And also, again, allergy-wise, you have to be really careful because one child may be okay, but it may not be okay for your other child to take. So don't share medicines. If your other child is sick, ask for them to be seen as well. Make another appointment to be seen by your pediatrician so they both have their own medicines as well. Another thing is, do you need to shake the medicine? So this may be surprising to some of you moms out there, but for example, medicines like liquid Tylenol and liquid ibuprofen, Motrin or Advil, you need to shake them, and you need to shake them well because otherwise the sediment, it sort of goes to the bottom, and so then again you're giving them medication but it's not really working because it's not all mixed through. So make sure that you read the labels, and if it says shake, shake well before each and every time that you give the medication, and this will help so that they get the correct dose each time and help them feel better sooner too. Multi-symptom medicine. So you've probably heard many things about this: cold and cough medicines, multi-flu symptom medicines, and really I don't like them at all for anyone, but especially for children. One, there's often ingredients in there that are not necessary, and so now you're giving your child this whole cough, cold, flu medication, and they don't really need some of the medications in there, and they can have side effects. They can make them jittery, they can make them cranky, and then there's also room not only giving medications that they don't need or ingredients that they don't need, but also you may overdose or underdose. So for example, there may be pain reliever in there already, and though it's not at the same, again, it's not based on the weight that you would give your child, so it has less. So now you're giving them less of this acetaminophen, but you don't know that, and then you don't know why they're still having pain because you gave them this multi-symptom reliever that supposedly had pain medicine. So now your question is, can you give them Tylenol? So you have to look carefully to see if Tylenol was one of the ingredients, or ibuprofen if that was one of the ingredients. So if it's fever and pain, so it gets really confusing, as you see what I'm saying, back and forth. It gets very confusing. So it's much better to give them one ingredient medications, and that's just the safer way to do it for your child. And again, you're not giving them extraneous things that they don't need either. So try to avoid those multi-symptom medications, especially for children. And then you want to know if a medication can be given on an empty stomach, or is it better with food? And most of them you can take with food, which makes it easier on the stomach, but there are a few medications. So again, speak with your pediatrician or your pharmacist to see if in fact the medication should be on an empty stomach or not. And then there are some medications that have interactions, and so you need to know that. I'll just give you an example. Some medicine like Ritalin for ADHD, so that can already make you a little bit hyper, can make you not hungry, and then giving a cold medicine on top of that can also make your heart beat really fast. It can make your blood pressure rise, so it's a real contraindication. So we don't like to give these cold and cough medicines to kids who are on particular ADHD medicine. So always ask about interactions, especially if you're on a long-standing medication as well. And then talking about sort of overdosing as well too, especially when there's young kids around and grandma comes to visit or other people. Kids love to be looking through pocketbooks, especially pocketbooks and bags, and oftentimes pills look like candy. Thinking about Valentine's Day today, but pills often look like candy, and kids get into them and they can open them and eat them, and that can be really scary. So you want to make sure to never leave medications out in the open or in any cabinet that a child child can reach, and especially when people come over, put their bags and pocketbooks away, because kids just naturally, I'm going to tell you this as a pediatrician, they gravitate towards grandma's bag and they like to look through it, and that's often, they may take a medication or iron pills or what have you that can be really dangerous to a child. And if that happens, it's really important to call poison control right away. Even before calling your pediatrician, if you have an overdose or you're scared about an ingestion, call actually you can just call, this is an 800 number, 1-800-222-1222. 1-800-222-1222, and that's the poison control number, and they'll tell you right away if you need to rush to the emergency room. You tell them what pills, and they'll tell you exactly what to do. But again, make sure that anything you have is in child-proof containers. Keep medicines for that specific reason in their specific containers, labeled so you know what they are. So if there is an ingestion or any problems, we can get the help right away needed for your child. So I hope that was helpful for all of you about avoiding medication errors. So, really to recap on that, the most important thing is know your child's weight. Make sure you give them the correct dose. Use the device that comes with it, or a dropper that's in milliliters, because that's the most accurate. And make sure you know the specific prescription, especially if it's from your pediatrician and it's a prescription that you're getting at the pharmacy. Make sure you know how many days it's for, how many times a day that you need to take it, and anything that you should watch out for in particular. And if you start off on the right foot, write down the medication that you're giving and the times, check it off. You'll be long ahead without having to worry about medication mistakes with your child. But now that you know all that, I did want to end by giving you guys some real tips on helping the medicine to go down. And yes, it's Valentine's Day, and I'm going to say a spoonful of sugar definitely helps the medicine to go down. This is the time when your child is sick that oftentimes the sweetness, the sugar, can actually help your child take their medicines. So starting with really young infants, oftentimes to give them medication, definitely using a dropper is the easiest way to go. So you just squirt it really slowly into their mouth, on the side of their mouth, the side and the back towards the cheek, very slowly, and 1 milliliter at a time. Let them swallow it. And that is probably the easiest way. You can swaddle them so they're not moving their arms around if you have someone else to help hold them. But normally babies, it's actually pretty easy to do if you're using a dropper. That's really the easiest way to do it. I think the toughest is when it comes to the toddler, right? So they're ones who want to give you a battle about taking their medication. And I can understand that. As I said, they're really not feeling well. They're not they're not acting how they normally do. They're cranky. They just want to be left alone. But if they take their medication, it's important. It will want to make them feel better. And for whatever infection or disease that they have, it will help them to feel better sooner. So it's important to take it. I'm going to say the first thing as a mom and a parent is to really be persistent and really you can hear them and say, I understand you don't want to take your medicine, but this is something that you have to do, and really just leave it at that. I think the more that you play into it, the more they're going to play you as well too. So you want to, sort of let them know that this is something that is really non-negotiable, that they have to take it, that you understand that they may not like it, but it probably isn't going to be as bad as they think. It's quick and it's over with, but you don't want at the beginning to give in, because if you do that, it's going to make it harder. Once you find your method, which I'm going to talk about some helpful methods, but once you find your method, after the first day or two, they see that you mean business, that you're not going to change your mind. And you know what? I hear this all the time. By the third, fourth, fifth day, they didn't like it, but they took it because they knew that mom or dad was going to make them take it anyway. So it's better to be consistent right from the start. Know that it's important that they take their medicine, but I do have some tips that can help. So for toddlers, so first of all, oftentimes medicines now come in chewables, which can be happy. They can chew it up, or you can crush up and put it in something like pudding or applesauce. That may be easier. Now many medications can have extra flavoring, so you can ask the pharmacist at almost any pharmacy now to add extra flavoring, and they have almost anything: cherry, strawberry, banana, chocolate, whatever your child likes best. Ask them to add the extra flavoring, and that can be really helpful. It's like a game changer for many of my patients, because they get to actually be in control and choose the flavor of the medicine. So even though the medicine looks white, it can really taste grape or orange or whatever the child wants, and that can be really, really helpful. Again, even with toddlers, I still think it's easier to use a dropper and to do it slowly. If you have two people, you can have someone hold them on the lap, and you want to squirt it in slowly into their mouth. Sometimes even pinching their nose, not hard, but just holding their nose will make them open their mouth if they first don't want to open their mouth. Then you can squirt it in slowly until they swallow it. What can be really helpful, and this is the key, is the chasers. So you can either mix the medicine, if it's not flavored, with chocolate syrup. This is like a favorite of many pediatricians that I know. They tell their patients to do this as well as I do. So you can mix it with the chocolate syrup, and that's just so thick and sweet that they don't taste the medicine. Or you can do a chocolate syrup chaser. So you do it first, and then they take the medicine and they have a little bit more. And another great tip to mix medicine with, and again, just a little bit, is frosting. So take your child's favorite frosting, whether it be chocolate or strawberry or whatever they like, and then mix the medicine into it, and then they just eat it right off the spoon with them mixed together. And that's a great way for them to take it. At this point, whatever it is, they're sick, whatever you can do to get the medicine down. As I said, a spoonful of sugar at this point can be really helpful. Just make sure then they chug it down with some water to make sure that they get it all down. But I've seen this help so many times, so I hope that will help. As I said, there are now other methods too. So there's new dissolving tablets. Many medicines over the counter are chewable, or they're just dissolving tablets where you put it on your tongue and quite literally they just dissolve, and those are great. And so it's so much easier for kids to take some of their medications that come in this dissolving form as well too. And then for older kids, you can definitely use this, the chocolate chaser. Sometimes also if they take licks from a lollipop, or especially like a popsicle or an ice pop, it's really cold in the mouth. Do that first. It's really sweet. They take the medicine and then they can finish up their popsicle, so they get sort of a sweet treat as well too. Great when they're dehydrated, because that also will help the sugar and the fluids as well. Slowly will be a great way to rehydrate as well too. And for older kids, depending on their age, but when they're feeling well, like teaching them to swallow a pill can be life-changing. I have so many parents that said that, once their child can swallow a pill, it's so much life-changing. You don't have to refrigerate the medicine. If need be, you can just, bring it out with you. It's easier to take it with just water. So practicing at an early age, there's kids you can do it. I've seen, 6, 7, 8, 9, definitely can swallow pills. But start with, some people start with candies, but what I tell patients is, go to the baking section, the baking aisle, and there's little candies that are made out of sugar that you can decorate cakes with, tiny, tiny little ones, almost like sprinkles. And you can start with those, and you can always get, once they do that, you can get bigger and bigger. But basically, you put it in and then give them a lot of water to drink, and they can practice when they're feeling well, because when they're feeling sick, it's going to be even harder. So when they're feeling well, they can practice swallowing. What's great about doing it with these little sugar cubes of these little baking, cake decorating sugar cubes is that they dissolve. It's just sugar, so you can be confident, tell them it won't get stuck in their throat. They don't need to worry about it, and then they can move their way out bigger and bigger and bigger. And I've seen that really be helpful. So once they can swallow pills, as I said, it's usually a life changer for parents as well too. You don't have to worry about them spitting out that medicine. But do make sure that when they take their medicine, and it's a pill form, that they drink a lot of water. Some teens think they're cool and they don't need to take water with it, but it can get stuck. You can get irritation in your throat, or it can get stuck in there. So it's important to drink water to make sure the medicine gets down into the stomach. So happy Valentine's Day to everyone. I hope these sweet tips were helpful to helping your child get the medications down easier, and also talking about avoiding medication errors in children. If you want more information, check out my website, drjen.com, and for more information about caring for your baby from newborn to age 2, with these tips as well as so many others, check out Pediatrician in Your Pocket. This is Dr. Jen. Happy Valentine's Day, and have a great day.